Chapter 7: Protection Motivation Theory. This video content is based on Introduction to Health Behavior Theory by Joanna Hayden. Let's explore a theory that explains how fear and logic combine to motivate health behavior. Protection Motivation Theory, or PMT. First is, what is protection motivation theory? Protection motivation theory was developed by R.W. Rogers in 1975 and revised in 1983. It was originally created to understand how fear appeals affect decision-making, especially in health contexts. PMT explains how people protect themselves in response to perceived threats, such as disease, injury, or risk behaviors. The theory focuses on two key cognitive processes: threat appraisal and coping appraisal. Second is the theory essence sentence. The theory essence sentence is: fear motivates people to protect themselves through two cognitive processes: threat appraisal and coping appraisal. In other words, people ask, how bad is the threat, and can I do something about it? Third is threat appraisal. Threat appraisal is the first half of the process. It answers, how dangerous is this to me? It includes two constructs. First is perceived severity. How serious is the health threat? Is it mild, like a cold, or life-threatening, like cancer? Second is perceived vulnerability. How likely am I to experience this? Do I believe I'm at risk? If someone perceives both severity and vulnerability as high, they are more likely to take action if they also believe they can cope. Fourth is coping appraisal. Coping appraisal is the second half. It answers, can I handle this? There are three constructs here. First is response efficacy. Does the recommended action work? For example, does wearing a seatbelt prevent injury? Second is self-efficacy. Can I do it? Do I feel confident in my ability to take the action? Third is response cost. What are the downsides or barriers? Is it expensive, inconvenient, or uncomfortable? Strong coping appraisal increases the motivation to act. Fifth is how PMT works together. When threat appraisal and coping appraisal are both high, protection motivation is strong. People are more likely to take preventive or protective action. But if someone sees the threat as serious but feels incapable of responding, they may feel anxious or avoidant. That's why both fear and empowerment are essential in behavior change messaging. For example, COVID-19 is serious. Severity. I'm at risk because I'm unvaccinated. Vulnerability. Vaccines are effective. Response efficacy. I can schedule one online. Self-efficacy. It's free and convenient. Low response cost. This is a textbook example of PMT in action. Sixth is real-world applications of PMT. PMT has been widely used in public health campaigns. Examples include smoking prevention and cessation, sun safety and sunscreen use, condom promotion and HIV prevention, cancer screening and vaccination, emergency preparedness and seatbelt use. The model works best when both risk and solutions are presented together. Seventh is strengths and limitations. Let's look at the strengths. PMT is useful because it combines cognition and emotion. It explains how fear can motivate or paralyze depending on coping beliefs. It helps tailor messages based on how people perceive risk and control. Now the limitations. If a message uses too much fear without offering solutions, it may cause denial or helplessness. The model focuses on individual beliefs, so it may miss social or environmental factors, and it may not apply to habitual or unconscious behaviors. Finally, let's summarize it. Protection motivation theory helps us understand how people respond to health threats. It says that fear alone isn't enough. People are more likely to act when they see the threat as serious, believe they are personally vulnerable, trust that the recommended action is effective, feel confident in their ability to do it, and perceive low barriers to taking that action. PMT helps us design persuasive health messages that empower, not scare, people into action. This video is based on Introduction to Health Behavior Theory by Joanna Hayden. Thanks for watching, and stay tuned for the next chapter on social cognitive theory.